Singapore has confirmed its first case of the Wuhan virus. The patient is a 66-year-old Chinese national and a resident of Wuhan. He's currently warded at the Singapore General Hospital in stable condition. The Health Ministry said that there is also a second preliminary positive case, a 53-year-old woman, also a resident from Wuhan, pending a second positive confirmation. Cheryl Goh is at the Ministry of Health, where a briefing on the situation has just wrapped up. Let's cross over to her now. Cheryl, what's the latest on this confirmed case?
Yes, that's right, Dawn and Glenda. So what we know right now is that the patient arrived in Singapore on a China Southern Flight CZ351 from Guangzhou on the 20th of January at 10:40 p.m. and he came with 9 traveling companions. Now, he did have a sore throat while he was on the flight, but no fever. The fever developed on the next day along with a cough. And on the 22nd of January, he did go to SGH emergency department by himself, and he arrived at 6 p.m. where he was immediately isolated. He was tested positive for the virus today, which is the 23rd of January at 6 p.m.
We have confirmed the first case of Wuhan novel coronavirus patient in Singapore. He has been isolated and warded in the Singapore General Hospital. And we have also started the contact tracing process. So far, we have identified 9 close contacts, and we will follow up with quarantine for them. And the process is still ongoing.
And in terms of where he stayed at the Shangri-La Rasa Sentosa Resort and Spa, and MOH tells us that he remained in the vicinity of the hotel for the duration of his stay, though the exact limits of this vicinity are still being determined. He traveled to the hotel from Changi Airport via a chartered car, and he took a taxi from the hotel to SGH. And now, MOH, as you mentioned, has also been notified of a second preliminary case. She's a 53-year-old woman who's a resident from Wuhan, though her test is still pending a second confirmation. And as of today in Singapore, we have 28 suspect cases. This is within the broadened definition of what constitutes a suspect case. And the ages range from 1 year old to 78. And so far, 7 have been ruled out.
Cheryl, what other steps is the Health Ministry taking in light of this new development?
And so, obviously, the first most important step is the contact tracing, and this includes the 2 drivers of the vehicles that the patient took, as well as the 9 traveling companions, though we do understand that 8 of them have already left Singapore, and the one that remains is his son, who is also showing symptoms of the virus so far and has been isolated. And there are also contact tracing for 30 close flight contacts. So these are people who sat 2 rows in front and 2 rows behind the patient. So all these people will be contacted and quarantined and monitored. The government will also step up border control measures, so this will be expanded not just from the Changi Airport, but also for all land and sea checkpoints.
In our deliberations, we have decided that there is a need to step up our overall posture, and we are enhancing our border checks. We are putting in place temperature screening, not just at the airport, but also at the land and sea checkpoints with effect from tomorrow. I think this is necessary given the rapidly escalating situation and also the high volume of travel that we expect during the Chinese New Year period.
And the Health Ministry has also updated its travel advisory to Singaporeans to avoid the entire Hubei province, so not just Wuhan anymore. But it also stressed that this is the very first imported case, and there's still no evidence of community spread as yet. So there is really no need to panic, but Singaporeans do need to remain alert and pay very close attention to personal hygiene. It's back to you guys in the studio.
All right, thanks for that. Cheryl Goh speaking to us from the Ministry of Health. And our reporter is actually at Shangri-La's at Rasa Sentosa Resort, where the patient with the Wuhan virus stayed. She will join us a little later in the bulletin with the latest on what measures the resort is taking.
Well, meantime, Prime Minister Lee Hsien Loong says Singapore has been gearing up for similar virus outbreaks since SARS happened back in 2003. He says that the country is better prepared now. Mr. Lee was speaking to the media on the sidelines of his trip to the World Economic Forum in Davos. This was before the Health Ministry confirmed the first case of the Wuhan virus in Singapore.
We have been preparing for this since SARS, because after SARS we made a thorough review of the facilities we had, the infrastructure, the hospitals, the isolation wards, and the scientific testing and capabilities. And I think we put a lot, we are much better prepared now. So within Singapore, I think we have to be psychologically prepared, and we also have to be operationally ready with scientists, with the healthcare workers, and with the community support. It looks like this virus is not as lethal as SARS, but you don't know, it can mutate. And so we have to be as prepared as we can, and that's why we set up an inter-ministry committee, and we have Kim Yong as well as Lawrence Wong chairing the committee, and pulling all the different agencies together, as well as grassroots organizations, as well as the private sector, and the healthcare community and the GPs, so as to be able to respond in a coordinated way. And so people can see that we are doing what we need to do, and we can go about our lives, take the precautions we need to, but no need to panic.
Mr. Lee also said that China is making progress dealing with the situation. He added that China understands that it has to work with other countries to tackle the spread.
I think within China they have also made progress in dealing with such public health emergencies, and they understand now that pretending that nothing is wrong is not the right thing to do, and they have to come out, and the more open they are, the more effective they can be in dealing with it, and better they can cooperate with other countries.
Now, the Health Ministry says that more than 900 GP clinics will be open at various times over the Chinese New Year period, and at least one healthcare group is adjusting its plans to be better prepared this weekend as concerns over the Wuhan virus rise. Gwyneth Teo with more.
While most clinics will be open on the eve of Chinese New Year, many will keep half-day hours. Only 79 will be open on Saturday, the first day of the festivities. But there will be 15 24-hour clinics open throughout the entire 4-day period, from the eve to 27th, and they are spread out across the island. The full list is available on various platforms, including the Health Ministry's website, the Community Health Assist Scheme webpage, and the Health Hub mobile app. One medical group says it's working to keep between 2 and 3 of its clinics open in each region. Not only is this the influenza season, the medical team is also preparing for the worst at a time when there are rising concerns over the Wuhan coronavirus. The group had to change operations and manpower plans that were already set in stone months ago.
Some of the strategies that we've been trying is to see whether or not we can consolidate our manpower, right, and to see if whether or not it's enough to open up another 1 or 2 clinics, or we've been contacting our regular part-time staffs and locums to see whether or not they are willing to come and cover the sessions.
Healthcare chain Watsons says it has seen an increase in demand for both N95 and surgical masks. It says it is working closely with suppliers to ensure regular replenishment of stocks.
Well, the Education Ministry has issued guidelines to primary schools about travel to China over the Chinese New Year long weekend. According to a circular obtained by CNA, staff and students who go to China must have their temperatures taken every day at the school general office for 2 weeks after their return.
And the 2 largest preschool operators have also taken steps to prevent the spread of the virus. Tan Se-hui with the story.
With babies as young as 2 months old and children up to 6 years old, PAP Community Foundation preschool centers like this one at Jalan Kayu is leaving nothing to chance. PCF Sparkle Tots is the largest childcare operator in Singapore. It has 360 centres and more than 40,000 children. Since Monday, temperatures are taken at least thrice a day, up from twice a day. And their cots are cleaned daily. At this centre, 2 of their staff members are currently in China, and PCF says that they will be closely monitored on their return.
We are advising our staff against any non-essential travel to China, Wuhan specifically. They are expected to also check on their health and well-being before they start work every day, and let us know if they're not well. They will be required to seek medical attention and will not be allowed to return to work until they fully recover.
PCF has asked parents to submit travel declarations and urged them to do health checks on their kids before sending them to school. CNA spoke with parents with young children, and while all of them think that schools have taken sufficient precaution, some have taken matters into their own hands.
What we do is we practically monitor the temperature, look at its condition, mind, and just look out for it. You can never know where it is.
For example, we are stocking out on surgical masks, N95, even though it's not very necessary, but just in case. And also if there's a case in Singapore and we might considering pulling our kid from school for a few days to see how it goes.
I have 5 children. Basically, I tell them that when they wash their hands, remember to wash with hand soap. You have to do it before you eat and after you eat also. And the importance of hydrating themselves, drinking enough water, and then of course the sleep, sufficient sleep.
Another preschool operator, NTUC My First School, said that it's in close engagement with the Early Childhood Development Agency. It said that it will comply with advisories on the prevention and control of infectious diseases. It has also stepped up measures at 140 of its centres, which cater to a total of 20,000 children. The measures include daily temperature checks for staff, children and visitors, including parents. Children will also be monitored closely.
The Defence Ministry has issued medical advisories to its service personnel, and those with flu-like symptoms are instructed to seek medical help and tell medical officers about their travel history.
That advisory was issued early this month. On Tuesday this week, personnel were reminded to adopt good personal hygiene and check the Health Ministry's website regularly for updates if they go abroad. Now, temperature checks are already being done before training to identify soldiers who are unwell. Those with a temperature above 37.5 degrees Celsius are sent for medical checks.
And with the city of Wuhan placed on lockdown, various airlines, including budget carrier Scoot, have cancelled flights going there.
The airline has scrapped its daily flights between Singapore and Wuhan till Sunday. Customers who'd made bookings before today can contact Scoot for a full refund or pick another Scoot destination within China, Hong Kong or Macau and travel by the end of next month.
And at the moment, Scoot plans to resume its Singapore-Wuhan flights on Monday.